Do you feel like your weight loss medication stopped working? Okay, well, we're going to talk about it. Hi, and welcome back to my channel. My name is Dr. Meghan. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is the place for evidence-based answers to your weight questions. So, welcome. Today, we're going to talk about something that I hear in clinic, and that is the idea that your medication stopped working. So whether you're on Wegovy, Ozempic, Mounjaro, Zepbound, or phentermine, something like that, you are worried because you feel like it stopped working. So let's talk about that. There is a window that we give a medication, in general, to assess whether it is working or not. And so if you have been on a medication for 12 to 16 weeks, so 3 to 4 months, and you have not lost at least 4 to 5% of your total body weight, that is a good time to talk to your physician about whether it is time to move on and try something else, or if you need to troubleshoot, go over your list of other medications, make sure nothing's interfering. That's a good time to check in with them and make sure there's nothing else going on, and do you want to try something else? But if you have lost weight, you want to think about, okay, am I close? Where am I in terms of the expected weight loss for this medication? For liraglutide, it's going to be about 10 to 12% total body weight. Wegovy and Ozempic, which is semaglutide, that's going to be about 15% total body weight. And then Mounjaro and Zepbound, which are Tirzepatide, that is going to be closer to 20%. If you have if you're very close to that, then you might just have reached where your body is going to get with this medication. So if you have, if you've lost 20% of your body weight, that you're not going to lose weight forever. Your body's going to kind of recalibrate on the medication, and then that's going to be your new normal. So it is expected and actually desired that you do stop losing weight at some point. You don't want to be losing weight forever. That would not be healthy. But at some point you are going to reach a new plateau. And so it doesn't mean that it's not working. Your body's just reached its new normal. And that's a good thing, but it's also, and I don't think we really talk about this, it's also a little, anticlimactic sometimes for patients because these medications work so well, and it can feel very magical when the weight is coming off, and then eventually it stops. And that's, you're going to be at that weight if you're not doing anything else. Ideally, that's the weight that your body's going to stay at, for forever. And so you have this transition period that's very exciting, but then you get to that new number and there's no more change. And so it's not that it's not working, it's just you've reached your new normal, and that can be a little boring. But you know what? In health, boring is fine. Boring is great. You never want to be medically exciting, really, okay? As a patient, you don't want to be medically exciting. You want to be medically boring. You're going to reach this new normal for you, and ideally that's where your body is going to stay. Now, if you want to continue to lose weight beyond that, if you feel like you want to get your BMI lower, if you talk to your doctor, you guys agree that's a good goal, then you're going to have to add something. So it's going to be, you're going to need to add lifestyle changes. Sometimes we'll add another medication on top of what people are on to start with, because some of these medications you can combine. You cannot combine the GLP-1 injectables, don't do that. But some of the other oral medications you can combine with those for a really good effect for people. But the bottom line is, if you want to get lower than that, something else is going to change. So that's going to do it for today. Thank you so much for watching. As always, my references will be listed down below, and please be well.